When someone has a baby, they have two options to choose from as to how to feed that baby. They could choose to breastfeed or they could choose to formula feed. Well, according to doctors Godfrey and Lawrence, about 71% of women start out breastfeeding their child. However, within a couple of months, that number drops to about 35% still breastfeeding, and the rest have switched to formula feeding. It's a really unfortunate statistic because breast milk is liquid gold, and research has shown that breastfeeding is more beneficial than formula because it has wonderful health benefits for the infant as well as great health benefits for mothers. Those will be the two main points that we touch on. First, we'll tackle the health benefits for infants. So according to doctors Godfrey and Lawrence, one of the main benefits that breast milk gives to babies is that it gives them an extra defense in their immune system. Antibodies can be passed from mother to child that help the body combat little nasties, bacteria, and all those things that a formula-fed baby wouldn't have access to help them with. And according to the article, The Benefits of Breastfeeding, that enhanced help will actually lead to a stronger immune system for that child and a child that's overall less sick. Within that benefits of breastfeeding article, it also states that breastfeeding can help combat childhood obesity. Human breast milk is more compatible with a human baby's system, and so less is stored into fat. That baby's metabolism is then off to the right start very early, and the likelihood that that child will struggle with obesity becomes slim. In that same article, it also states that breastfeeding can help prevent some devastating illnesses, asthma, diabetes, celiac disease, even some childhood cancers were all lower in children that had been breastfed as opposed to children that had been formula fed. And finally, it's hypothesized but not proven that breast milk can actually lead to improved cognitive development. So it's possible that breast milk can actually lead to more intelligent children, as it states in that the benefits of breastfeeding article. Now, also I mentioned that I would touch on the benefits that breastfeeding has to mothers. Doctors Godfrey and Lawrence state that one of the main ones is it helps combat postpartum depression. When a woman's breastfeeding, it releases hormones that act as a natural antidepressant to make the woman calmer, less stressed, and less prone to the post-baby blues. Another great benefit, according to Dr. Blinko, is that actually breastfeeding can help a woman lose weight. Breastfeeding burns 200 to 500 calories per day, which would, as you can imagine, would definitely help a woman lose weight quickly. It also helps to shrink the uterus back to its normal size to get rid of that baby bump after the baby's been born. Also, breastfeeding acts as a natural birth control. Doctors Godfrey and Lawrence said that your body, a woman's body, can prevent itself from ovulating if a woman is exclusively breastfeeding for about 6 months. So the body will keep a woman from getting pregnant before her body is ready to. And another great benefit is that women who have breastfed statistically have about a 25% less chance of developing breast and ovarian cancers, according to Dr. Blinko, which is just a wonderful benefit that it provides. Now, to breastfeed or not to breastfeed, that is the question that I have posed. And let's take a look at how that relates to real life in a more relatable way. If you see the woman on the right, she chose to formula feed her baby. She's wrestling with self-esteem because she hasn't lost the baby weight yet. She's struggling with the crippling effects of postpartum depression, and she's worried that she could become pregnant, having to deal with a pregnancy and another baby on top of the difficulties of the baby she already has. Unfortunately, a lot of her problems could have been helped had she chosen to breastfeed. Now, the woman on the left does breastfeed her child. She just looks happy, doesn't she? She's lost her baby weight and she's back in her pre-pregnancy clothes and has a self-esteem and a confidence to her. She isn't as stressed with the difficulties of raising a baby because her body is relaxing her naturally. And she doesn't even have to worry about getting pregnant too soon because her body's preventing it and she's free to focus on her beautiful bundle of joy. So in conclusion, I want to reiterate that breastfeeding is more beneficial than formula feeding because it does have wonderful health benefits for infants as well as great health benefits for the mothers. And it is my hope that after this presentation, you will become an advocate for breastfeeding in your own families and communities. Are there any questions?
Yes. Is feeding a baby pump milk still better than formula?
Great question. Many women do pump to feed their children breast milk, and it is still better than formula as long as a few conditions are met. Doctors Rasmussen and Garati say that there are like 3 main characteristics of how to best preserve pumped milk. That's to make sure that you sterilize the equipment very well, to make sure not to microwave breast milk because that kills the antibodies, and to make sure not to refrigerate or freeze breast milk for too long because that deteriorates some of the goodness.
When should a child stop breastfeeding?
That's a difficult question. The question isn't when should you stop, but really how long should you continue? So the Center for Disease Prevention and Control, the CDC, states that the American Academy of Pediatrics recommends 6 months of breastfeeding, while the World Health Organization recommends 2 years of breastfeeding. So somewhere in between there or after that, as long as both mother and child are comfortable, the longer the child is breastfed, the better the benefits.
If a woman breastfeeds, can she still drink alcohol?
Yes, it can be done. There are obviously some stipulations that have to be met. If there's alcohol in your blood, there's alcohol in the breast milk. And so while actively drinking, no, you shouldn't breastfeed. However, Dr. Manella states that alcohol is not stored in breast milk. So as long as enough time has passed for the alcohol in the breast milk to metabolize, the breast milk is perfectly safe for the baby to drink. Thank you.